Good afternoon, everyone. Thank you so much for joining us. I would like to take a moment to welcome our two panelists who will be discussing with us today the importance of community outreach and community partnerships in relation to the prevention and self-management of diabetes efforts. So first we have Mrs. Brenda Hoffman, who is an LPC. She currently serves as the director of the organization's Southwest Border Area Health Education Center. And her expertise from a Master of Arts in Counseling Psychology and Skills, honed as a licensed professional counselor, made her a success in nonprofit, higher education, and private practice arenas. In 2004, Brenda began her professional career experience working at Serving Children and Adolescents in Need, a nonprofit organization in Laredo, Texas. She served as an at-risk counselor for the STAR program and eventually was promoted to director for SCAN's Sexual Assault Services and Information program. During her time at SCAN, Brenda was exposed to evidence-based prevention, intervention, and treatment services geared towards fostering a healthy development for families. 8 years later, she decided to head back home, and for the past 11 years, she served as a counselor and part-time instructor at Southwest Texas Junior College in Eagle Pass, Texas. She also established strong relationships with partners from the community and has coordinated several activities that are aimed towards raising awareness in different issues and social determinants of health. In October 2010, Brenda established Nuevo Amanecer Counseling Services PC, and in late 2018, she decided to join AHEC, where she continues to promote health careers, provide support and educational resources for residents of Maverick, Kinney, Valverde, Edwards, Real, Uvalde, and Zavala counties. Also joining us on our panel today is Mrs. Dora Fast. She is joining us from South Texas Rural Health Services, Inc., where she is a chief nurse practitioner. She holds a family nurse practitioner with a doctor's of nursing practice degree. Dora first obtained her Bachelor's of Science in Nursing in 2007 from UT Pan Am in Edinburgh, Texas. And in 2013, she obtained a Master of Science in Nursing from UT Health Science Center, San Antonio. Just recently, in May 2022, she received her Doctor's of Nursing practice degree from UT Health Czech School of Nursing in Houston. She has worked as a chief nurse practitioner with South Texas Rural Health since 2014. She is also a member of the Compliance Performance Improvement Committee, administration team, and serves as a clinical preceptor for the new FNP and FNP students. She is passionate in providing quality healthcare in the medically underserved population and has experience in the Hispanic rural population. She enjoys teaching and encouraging lifestyle changes to her patients. When not working, she enjoys the outdoors, going hiking, walking, traveling with her husband, son, and Labrador. So thank you so much, both of you, for joining us. We are so happy to have you here today. Now that we have learned a little bit about each of our guests' background, I'm going to quickly go over our objectives for today. So today we will discuss the opportunities available for community partnerships and outreach to aid in comprehensive preventative and self-management services. We hope to understand the importance of community outreach in relation to prevention and self-management services related to diabetes. And we hope that we find different ways to promote and enhance the availability of comprehensive preventative and self-management services. So before we go ahead and get started, we would like to start off with a little word cloud question. So the question, for anybody who has their phone handy, if you'd like to just kind of use your phone to click on to put on the get the QR code, but if not, on our next slide here, and Maria will go ahead and also plug in a link that you can just copy and paste on your browser so that you can have access to the question. So the question that we'll be looking at right now is, what services do patients in your community seek out the most to aid in diabetes prevention and self-management? So please take a moment and send in whatever responses you have of what services you have seen that patients in your community seek out the most when it comes to diabetes prevention and self-management. You can go to www.menti.com. It's right up on the screen, and use that code 39786596. Remember to put that little space in between each of the 4 digits, because it won't work if you don't include that space. So we'll take a few minutes. And examples of this could be like, sometimes patients are seeking transportation assistance to get like to their medical appointments, or sometimes they're seeking food assistance. So that's really what we're looking for here. Just kind of plug in whatever words, whatever services you have noticed that your patients in your community seek. I hope that it's working. We tried it earlier and the words were appearing. So Maria, do you want to try plugging in a word just to make sure?
Yeah, it's not coming up.
It's not coming up. Yeah, I guess I apologize for that. It did work when we practiced it. I'm not sure if it's just taking a minute, but if you'd like, we can use the chat instead. If you can please go into the chat box and just kind of type in, what services do patients in your community seek out the most to aid in diabetes prevention? And I'll go ahead and read those out loud as they appear in the chat box. Safe places to exercise, diet, exercise, medication, dietitian supports, meal planning, lots of different transportations, medically tailored meals, PCPs, yes, health centers, transportation assistance, again, outreach, case management, Spanish education, right? Nutrition, gym memberships, yes, lots of prescription assistance as well. Access to affordable food sources, again, transportation, diet, medication, SNAP education, more transportation access to clinical appointments, help with medication cost, DM testing supply assistance, right? Debit card for fresh fruit and veggies, assistance with medical supplies or access to medical supplies, diabetic education, diet and access to healthy food, medical van visits with mobile clinics. Yes, all great ones. How to navigate the system and understand their benefits, right? So that's where that case management comes in. Great. Well, thank you all for sharing. If more come up, you can feel free to plug it into the chat. These are all great. It sounds like we are seeing similar trends in the resources that are needed within our different communities. So now that we've identified those different services needed, resources needed, can you please now type into the chat, have you actually been able to establish community partnerships to meet these needs? So if you can type in yes or no, and if yes, can you just plug in, kind of start naming some of those community partnerships or types of community partnerships that you have established to be able to meet these needs for your patients? Ruby says yes. Yes, local food banks to help provide food for families in need. Again, more food banks. Bigger grocery stores have dietitians on staff. We offer DEPP workshop at our FQHC prevention class with bus route passes. Yes. We work with different programs that provide healthy food and nutrition education, community clinics, Medicaid for DM testing supplies, establishing PCPs. Some health insurances provide discounted programs or free memberships. Yes. Free nutritional education, sliding cell clinics, different church organizations, relationships with growers. Yes. The various different health departments to work with different health issues. Oh, someone said we offer emergency food boxes, right? YMCA scholarships, so maybe different scholarships available in your communities. Community health fairs, right? Member share car rides and trade services. These are all really good partnerships. Dietitian education, assistance with rides again, developing relationships with community health workers, right? Via Chair Community Health Association Inland Empire Region. Right, so great. This is all great. So once you have identified what services are needed, the gaps that you need to fill, it looks like you're really working hard towards finding different community partnerships available and who you could connect with in order to meet those needs of your patients. So that's great. Applied for grants for food pharmacy, food bank boxes, and a virtual visit with a dietitian. Oh, wow. Nice. It's good to hear what's out there and share these with one another, because sometimes there may be some resources that somebody knows about and others don't. So thank you so much. And again, if you something else comes to mind, just continue to pop it in the chat so that others can view. Thank you. So thank you so much for that brief little activity. That's just kind of to give you all an idea of what we'll be discussing today during our panel. So thank you all for participating and sharing. I would now like to turn it over to our panelists so that they can tell you a little bit about each of their organizations and the populations that they serve respectively. So Mrs. Brenda Hoffman will be going up first, and then Mrs. Dora Fast will follow right after.
Thank you so much, Megan. So hi, good afternoon, everyone. My name is Brenda Hoffman, and I am the program director for the Southwest Border Area Health Education Center. We are located in Eagle Pass, which is in Maverick County. And within that, I guess a brief summary of what we do. We provide opportunities for students, for healthcare providers, and for anyone, that's in need of any type of service. Now, our mission is to improve the quality of healthcare by addressing the shortage of healthcare professionals. Our area here is very underserved and rural, and so we provide opportunities for students in hopes that they will stay and we will retain them for at least a few years. And so within that, we also work a lot with community health workers. And what we do with our community health worker-led programs is we promote healthy lifestyle practices based on the needs of the community. So we do a lot of advocacy. We do a lot of capacity building within AHIC and within the regions and the service areas that we work in. And so within that, we work in Maverick, which is where we're currently located. We work at Kinney, Valverde, Edwards, Real, Uvalde, and Zavala counties. A few of the things, like I said, that we provide is we have several programs within AHIC. And so the first one being that it's a PEAKS program. And this PEAKS stands for Providing Enrichment Academic activities and knowledge to students interested in healthcare. The program is designed for high school and university students who aspire to become healthcare professionals. We promote academic preparation through this program and motivation for high school and college students through year-long sessions and through summers programs. Again, these summer programs are designed and they're developed to help enhance, our student population, help develop them academically, and help them with, feel, that confidence, that sometimes we may lack, and in again, hoping that they'll, continue with the aim, that they have in mind in becoming, healthcare professionals, and hopefully we'll see, them returning back and giving back to their community. We also have the VOCES program, which is the stands for Vitalizing Our Community Through Education and Support. And this is a CHW-led program. Again, like I said before, we do work a lot with community health workers. And within this program, our community health workers provide a lot of education and outreach, whether it be at a health fair, whether it be through a community health club, which I will speak about in the next few, minutes that I have you here. And they also help bridge that gap between individuals and healthcare providers to improve the outcome of a variety of health conditions. And another exciting thing that we do here in AHIC is that we provide the CHW Certification Training. For those of you that are not familiar with community health workers, I invite you to go through our website so that you can see what CHWs do for our communities, and especially for AHIC. I always tell my the people who I collaborate with that just by working with these individuals and by listening to these individuals, that's how come we're very successful in some of the things that we've done, because we listen to them, and they're the persons with lived experience. And so a lot of good information comes from these individuals or these community health workers. So again, become familiar with what it is, and if you guys are interested, feel free to let us know. The training is provided in English and in Spanish, and so it's a great opportunity, and it's a great certification for you to have. And then as an AHIC, we also provide continuing medical education for healthcare providers and continuing education for mental health care providers and community health workers. So again, AHIC is about healthcare, reaching, communities and providing opportunities for those that, are interested in healthcare professionals, and providing the education for those that, may need information on any type of emerging current health issues. Thank you, Megan.
Thank you so much, Brenda. Mrs. Dora Fast, you can go ahead.
Thank you. Thank you, Megan. My name is Dora Fast. I'm a doctor of nursing practice, family nurse practitioner, and I am in close to Miss Brenda on the east side, South Texas, south of San Antonio, or South Texas Health System is a federal qualified center, classified as a primary medical home. And as a medical home, we provide medical, dental, behavioral, and substance abuse services to our rural population of South Texas. So we serve 6 counties. In the previous slides, show you the counties that we were in. We do have Maverick County in for counseling services. So South Texas is from, if you know the area of South Texas, from San Antonio down to Laredo. We 30 miles away north of Laredo, Texas, which is Ensenada, little town of Ensenada, rural area. And then we go all the way to Uvalde for counseling, Eagle Pass and counseling, and Carrizo Springs for medical, dental, mental health, substance abuse services, and all the way to about, I would say 30 miles south of San Antonio, 40 miles, which is Divine. Right now I'm covering for Hondo Clinic. So we provide primary care services for throughout the lifespan from newly born. We get them. We see them for immunizations, and we see them all the way through the very, very old. Continuation of medical care throughout the lifespan, that's what we do. So we do have a medical clinics in rural settings, and we'll go more into what the population is that we provide health services. We have also 7 substance abuse centers with those same medical clinics, and we have licensed professional counselors, licensed chemical dependence counselors. We have dental doctors, we have our medical director, and then the rest we are family nurse practitioners on it. So back in South Texas Rural Health System Services was first established in the little town of Washington, and that is a little town outside of Carrizo Springs. And then the first building was actually built in Cotulla, Texas. That's where we have our main headquarters, administration building. And then we have it in Divine, Pearsall, Dilley, Ensenada, Hondo areas, and Carrizo Spring. We are a federal qualified clinic, so we need to have a governing board directors. Those are the ones that governing body that we have. We have the lateral administration, which is the CEO, COO, CFO, and then the medical providers. Target population for South Texas is a rural community. We are right there in the rural community where we have maybe one hospital around 60, 80 miles surrounding. Our high population is composed of high chronic disease populations. We have diabetes, hypertension, hyperlipidemia, obesity, asthma, skin disorders, lung diseases. We see them all. We accept all kinds of medical insurance and also non-medical or non-insured, what we call it. And we go by a sliding fee depending on the income of the individual. And most of the population are non-insured. So there's a minimum fee that the patient pays, $10 per visit, depending on the sliding fee. And then minimum charge for laboratory testing, which is a $3 per laboratory. That will be a panel of everything. So it's has a federal qualified center. We provide those fundings because of the grants that we receive by entities such as the HRSA, which are the ones that provide the funding for the providers and keeping the clinics open. We depend a lot on grants, federal grants for services. And we have also what we call a mobile medical unit that goes through other communities, and I can explain more as we answer those questions. We utilize that also to go to the county jails and provide medical care for the inmates. We were approached by the counties, 2 different counties, Frio and LaSalle County, to provide medical help for their population, and that's what we do. I do cover that area too. I go once a week, and I see the same thing in that population: diabetes, hypertension, substance abuse. So, and that's where I am right now.
Thank you so much, Mrs. Best. So thank you both for that bit of insight into each of your organizations. So as y'all can see, we have with us today two different perspectives instead of experiences. Mrs. Brenda Hoffman comes from a community partner organization that can provide supportive services to help meet the needs of the community health center patients and staff to be able to provide those comprehensive preventative and self-management services and help fill the gaps for needs to be met. While Mrs. Dora Fast works directly with the patients, where she is able to see and hear firsthand from patients what services they are needing to help in their diabetes prevention and management. And she works to establish these community partnerships to be able to meet these needs. So with that, we will now begin our panel discussion. We will be asking our panelists a series of questions. But please feel free to plug in any questions or comments that you have along the way. Just utilize the Q&A or the chat box, and we will address them as we go, or we can address them at the end. We'll also have a few minutes. So we'll go ahead and start our panel discussion. And our first question, how do you or your health center or organization identify the specific needs within your patient population when addressing their diabetes prevention and self-management care? Ms. Fast, if you would like to touch on that first.
Yes, so one of the first thing that we as providers need to do is to know the community, to know your population. What kind of population you're gonna be providing health services. And you need to, just because you came out of the medical school or nursing school or any type of education, doesn't mean that you know the population that you're gonna be attending. So you need to first understand what is the population that you're providing services to. So that's, you know, to know the area. So one of the ways that you can do that is by obtaining, what we do is a community health needs assessment. You can get that from any of the hospitals that are near in your area where you work or where you live, and they will do that periodically. So has a requirement for a hospital is to do a community health assessment. And I do I say a hospital, you can do it yourself. Your agency can do it, a community health needs assessment. But if somebody else pays for that already, well, and they post it in public, and some website on the internet, you can access that report. It's very easily, just go in and check what it is, a community health assessment. So I know that area. I grew up in Laredo, so Laredo and I went to McAllen area. So they're the border areas. They're about the same population that I work now with. So, but I am more in the rural population. South Texas, where I am, is rural. So that's what I do. To know the needs of a patient, I want to know what is in the community. Get to know the community, get to know that area, go out and drive around. That's what I do. I want to see what do we have in the community. If I see that in the community, you'll see fast food restaurants and you see no parks, you see no walking trails, and you see grocery stores that are not does not provide a good source of food items, then you will have an idea what kind of diseases or chronic diseases you will see. That's how providers will look into it. Then as I obtain a report, I want to see what is the percentage of people with diabetes? What is the percentage of people with hypertension? How high is the diabetes rate on your area? That's what I look, and obviously you will see that just walking around and go to the store or go to a restaurant, and you will see, you will have a main idea of what needs you will see as you see the population. Now, once they come into, at the moment a patient comes into a clinic and I do an assessment, right away, the first thing I do is an assessment, a head to toe right away, and I have an idea of what kind of problems would I will probably be seeing. So that's how we do. So as a provider and as an organization, we need to have those reports in hand. If you cannot get in, then you sit with your administration and say, hey, we need to do a community health assessment. Need to find out how high is diabetes, how high is hypertension, highs like these? What kind of populations do we serve also? Do they have a high school diploma? Do they have a post-high school studies? What is the income of that community also? Because that also will tell you on the population, the per capita income of the community. You need to know if it is a high capita or is it low, or is it, how below are you below the 100% poverty level of the population? You would have an idea. And obviously you can always go and I'll check on the CDC constantly reports from them, and they'll tell me, obviously, I'll see the report from them and I can say, yes, I agree with that result because I can see that in my patient population that I see. So has one of the supervisors for the medical directors, I need to help my staff. You need to identify those needs. You need to be versed on what kind of community you serve it. If you don't know, then we're gonna have a problem in helping and coming with solutions to treat problems with that population.
Perfect, thank you. And kind of going from there, can both of you, now that you have kind of figured out a way, identified, learned about your community, learned more about what the needs of your community are and all of that, we also heard a lot about from the audience of a lot of the barriers that patients encounter, including agriculture workers. Maybe they have problems accessing transportation, food, like we heard earlier today as we began this webinar. Can you both tell us about some of the strategies you have in place to identify and connect with community partners? Brenda, if you'd like to start with that.
Sure. So I guess to add to what Ms. Dora was saying, one of the key things that I like to mention is that in order to identify, specific needs, and in order to identify, the proper strategies, a lot of collaboration has to happen. That's key. When trying to identify needs and strategies, we rely a lot on, the information that's obviously given to us. As an AHIC, or as the Area Health Education Center, we have strong collaborations with, our local, FQHCs, United Medical Centers, the Maverick County Hospital Districts, our local hospital. Even though our hospital isn't a public hospital per se, it's private, we also do a lot of work and collaborations with them. I guess the strategies that we have in place involve a lot of prevention and intervention, and it's just mainly, like I said, a collaboration amongst all of us. What can we do as an AHIC to help begin the conversations about prevention? What can we do as an AHIC to provide also intervention services? What can the clinic do? Our United Medical Centers, who is, who we have here. What can Maverick County Hospital District do? What can the hospital do? And so the strategies that I guess that have been put in place, and the programs that have been put in place, it's it's a lot of coming together and having these types of discussions here locally, within AHIC. Again, our work is focused on education. We have what we call community health clubs that address not only diabetes, but chronic conditions. And within the community health clubs, we invite, the community, including community health workers. These clubs are actually CHW led. These are sessions that we use an approved curriculum to be able to teach, I guess about, it could be diabetes or chronic conditions or chronic disease. And we provide them with, the information that they need. Here locally, we also have a Caminaremos Juntos program, which means walking together, where they also address the importance of, having a healthy meal. Again, we all come together to be able to, build capacity and mainly, educate and I guess work with our community to find out, what it is that we need to do. But it just doesn't take one person, to build on these strategies, or one, organization. Everyone has something to give. And so, again, the strategies that have been put in place are due to, people coming, organizations coming together, and having a discussion about, what they're hearing from their patients, what we're hearing from these persons with lived experiences, what they're hearing, what we're listening to at, with our students at, our local high schools, and so forth. And so again, a lot of the times, if it's, putting together a health fair that addresses that specific need. This last year, we put together a local health fair, and we attracted a lot of individuals. It's, we're listening to the community. We're listening to the people that live within Eagle Pass, within Maverick County or within the county that we're serving. That's how we create, I guess, those strategies and those opportunities, for them to join again, to take care of their health. The question is always that of, how can we build on capacity? How can we help them become more aware of, making mindful choices? I don't know if you have anything to add to that. I don't want to take much of the time. I know it's 1:40.
I do what we did in South Texas, or SCHR, like we call it. We our committee, performance for improvement committee. We identify the needs of our patient population, and then we address those needs. And one of those needs was to come up with an individual that would do outreach, specifically that outreach. Obviously, we are in 6 counties, and it's a broad area. So our administration and our medical staff concurred that we needed an individual that would do just that, be outside in the community. And that individual was hired, and we are now promoting outside into the community. If the individuals don't come to us, then we go out and to them, and we utilize what we call the mobile clinic. And we do the same thing, health fairs. We invite individuals from the different areas, surrounding areas, from San Antonio, in Laredo, in Eagle Pass, and we invite them into health fairs the same way, in helping to bring their services, the food bank, their outreach. One of the ones that we utilize a lot is Methodist Healthcare Ministries, and we help them. We keep a contact of those individuals that we come to know, and we put them in what we call a referral binder, where we have names, phone numbers, contacts to say, okay, this individual or this entity provides these kind of services, either help us with the food, or with the transportations, or medical equipment, or diabetic equipment. That's what we do. And that individual, which is called the Chief Development Officer, is the one that brings us those contacts, and we put them in a binder, and then we provide those to the medical providers.
Great, thank you so much. Thank you both for sharing that. So we've heard a lot about learning your community, listening to your community, and really building those collaborations with all community partners or anyone that's near or close, your surrounding areas that you can possibly get connected with or work with. So can each of you just quickly just highlight in your experience, what makes community engagement and partnerships so important in increasing diabetes prevention and self-management efforts?
Let me go for that. Obviously, with dealing with diabetes or chronic disease is a task. It's a huge, major task that we need to do. Is something that is been there for years, and to undo something is, or to make a change is, or break a habit is difficult. So increasing that education on diabetes, the consequences of diabetes, the sequelas, the damages that it brings, it is obviously very important for us as providers, but also engaging individuals, that not only that the patient or the people hear it from someone else, not only the providers, is going to bring more emphasis to okay, awareness to a disease. And that's what we want. Obviously, the more the merrier, like we said. So if we have a patient that comes to my clinic and say, well, we did some tests and we came to find out with the diagnosis, the result tells us that you have this diagnosis, diabetes or hypertension, and they most likely will say, no, they're gonna be perplexed or hesitant to take that or accept that. So if they go with someone else, and we refer to another person that can help and also educate them. In this case, what I do, I send them to Wesley Nurse for diabetes education and diabetic supplies. They hear it from someone else, not only the providers, but it brings like a confirmation for them. So it is very important to engage the community partners outside. So let them know, hey, we understand, and it's hard to take that diagnosis, but we're going to help you get through it, and we're going to help you with that.
Great, thank you. Is there anything you'd like to add to that, Brenda?
Yes, I guess one of the things that I like to add is that I guess the reason why I guess I feel that the community engagement and partnership is so important is because we are so underserved. Physicians can't do it all. No,
Right.
CHWs can't do it all. You know, our hospital can't do it all. I mean, we've, you know, by census, and this is obviously census, you know, some of us do the census and some of us do not. Here in Maverick County, we have a population of about, you know, 59,000 individuals living here. Now, mind you, we're not talking about the issue that we're having with, you know, immigration. So if we don't collaborate, you know, they don't collaborate with us, you know, we don't have that, you know, those types of conversations going on. It's, you know, going to be very challenging for each and every one of us to have, you know, that, you know, self-management or even have any type of prevention going on. And so, like I said, I think collaboration is extremely important because, you know, AHIC can do one thing, you know, United Medical Centers could do another, you know, Maverick County Hospital District takes care of another thing that might be needed. And again, we have to come together to be able to do that because of how severely underserved we are. You know,
Thank you.
knowing our role, you know, within a community is key. You know, knowing that, you know, the Area Health Education Center can provide the education, you know, the prevention aspect of it, knowing that, AHIC, knowing that United Medical Centers or Maverick County Hospital District could provide the, clinical aspect of, taking care of, what needs to be taken care of.
Right.
Just that, that needs to happen, I think,
Mhm.
because again, we do not have the providers, or the, the manpower to take care of, our needs. So.
Right. Thank you. So yeah, it sounds like it's also about getting to know what each partner organization or community organization has to offer, so that because everyone can do something different and can offer something different, right, to the patients. So I know that you both have mentioned a little bit about how community partnerships also help with patient retention and engagement. Have you seen, I guess Ms. Fast, have you seen an increase in patient retention and engagement due to community partnerships that you have built? And have you noticed if there's been a change or a trend in patients being more connected to the health center and really more engaged with their own healthcare?
Yes, when so the patient comes to me maybe once every 3 months. I don't see them every single week, or maybe if it is out of control, then I want to bring him sooner than every 3 months, once a month if I need to see them. Obviously, they're not gonna have the monies to be coming every week to me or once a month. So that's the other I can utilize. In this case, I go back to Wesley Nurse because that's what we have. They are, there's not a fee. The only thing that they require is that they have follow with me and or the providers to do the blood testings and the checkups. And then I'll send them the report to them, obviously with the patient consents. We have to have an open communication, a constant communications with them. That helped me in retaining my patient because that patient, when I said, okay, I'm gonna send you for this one, so you can get the diabetic supplies, and then you're gonna follow the schedule they have, and then you come back to me. And it helps me to retain my patient and to have a follow-up with them. Whenever I don't see them, I know somebody else is also seeing them throughout that time frame. So it helps me to retain that. Not only retain the patients and then say, well, now you need to, she's also the one saying, now you have an appointment coming up and I want to see you that. I want to see how well you're doing on your A1C. So it does help in retain the patients for that. Whenever they come and they say, and I give it, okay, I need for you to change your diet, go to the food bank. And I mentioned that I see that many of you also share that, the food bank. We do have it here too. You give in a coupon or you tell them, okay, this is good that you can get from this food bank. This is not good for your diet. So we help them, we send it and they come back and say, yeah, I got it. Did you receive the voucher? Did you get not the voucher? And it helps us. So I don't see them for 3 months, but somebody else is watching them. So kind of an accountability, may I say, for them.
Right. Thank you. Yeah, that's so true. Can I guess both of you just quickly share how have you seen community partnerships, specifically when it comes to ag worker populations? Have community partnerships helped you to maximize your organizational resources in order to extend services to your ag worker populations?
Oh, yes. So what we did with South Texas, we do have a wellness center.
Mm-hmm.
And it is a full, well-equipped wellness center. It's like a gymnasium. We had the basketball courts, we had the volleyball courts. We also have a room for lifting. We have stationary bikes, and we have a room for videos with Zumba and Fit. And then we have a full kitchen. That's a wellness. That was provided by one of the community partners, which is the Methodist Healthcare Ministries. They donated that grant to build that. Now, in every other clinic, that is the main building in Cotula. In Pearsall, we also, with the grants provided by that community partner, we built also a room. It was remodeled for weights and exercise program. And we also have the kitchen there too. We also have the other one in Divine, clinic in Divine, that we do the same thing. And now the other one, the brand new one, is in Carrizo, Carrizo Springs, provided by the one of the community partners, which is Methodist Health Ministry. So when you provide, when you see the need and you identify the need, and then you come up with a solution, you present it to your community partners, and that help build that wellness centers in the different clinics, without affecting the other financial aspect of the organization. We still need to see the patient daily. We still need to provide laboratory testings. We still need to have the medical assistant help us. So those that partnership with the Methodist Healthcare Ministry and South Texas Rural Health help us maximize the resources that South Texas has.
Thank you. Is there anything you want to add to that, Brenda?
Yes, I guess the thing that I like to add, even though we are not, a clinic, the partnership that we have established with United Medical Center in regards to them referring their patients or their clients to our community health club. I mean, we've seen how it's, it's a different conversation that they're having with our community health workers. And so a lot of the times we do see that they make that connection. And once they're able to do that, they're able to, I guess, learn and have the motivation to want to do something about, their health. And so what I've seen in the conversations that I've had with, here with our local, with our community health workers and our FQAC, the United Medical Centers, is that even though we've, like anywhere else, we wish that a lot of our, their clients or patients to take advantage of it. Those that are taking advantage of attending our community health clubs, they're making a change and they're seeing an impact. And so a lot of the times, it's just a matter of, you have a question, you try to call your, PCP or the person that's, the healthcare provider that's helping them with, their current condition. And so a lot of the times they're not able to get a hold of them, or a lot of the times they have to wait a few days, 2 to 3 days before they can sometimes get an answer from them, because again, we are so underserved and everyone's, at capacity. And so sometimes it's easier for their clientele or their patients to call one of our community health workers to see if maybe they have an answer to their questions. And so we don't necessarily work only with ag workers. We work with the entire population, but when an ag worker is identified, then we make sure we put in the work and we tie in a little bit more information than what we typically give out. Our community health workers, conduct follow-ups after they attend these community health clubs, and they make sure that the clientele or the patients leave with, knowledge, with the education, and that along with that, we give them, we provide them with a lot of free the glucose, testing, and we do a lot of other neat stuff for them. But again, I think that partnership that we established between United Medical Centers and AHEC, and having that referral system with, their patients have really helped maximize the resources and not just the ag population, but overall as a community.
Thank you. So I know we're getting close to time, but just to kind of end this discussion before we go answer a couple of questions that we have, can each of you just share with us your most successful community partnership that you have made, and what is it that made it so successful?
I think mine is the one that we established with the Methodist health system, which is the Methodist Healthcare Ministries. We had grant writers in our organization, and we saw the need for a gym in each of the clinics. And they went and said, we need a grant because we don't have the money. We don't have $2 million for that. So they wrote the grant and they presented, and it was granted. And they came just by the end of May, they came to visit the Methodist Healthcare Ministries. The CEO and the staff came to visit in the buildings that they gave us the grant. It's successful because once we established that, we were able to provide hire what we call health exercise specialists, the ones that will provide one-to-one exercise programs for the patient. And they were also required to take the testings and certifications to be able to do that for them, and they'll pass. So we not only have that on helping with diabetes or exercise, but also we also given the responsibility to do what we call a healthy heart program, where we do blood pressure readings, we check medications, we record readings, and we do like an assessment, and then they go into the gym. So it's expanding. Once you start with something, a little program, then you utilize it for different programs.
Thank you. Brenda, did you have anything to share?
So I think besides, our efforts to partner with our local clinics, getting the city of Eagle Pass involved, get your city officials involved. I think that we've been successful at our health fairs and at the different events in the different projects that we've had, because of the strong collaboration that we've had, the AHICs and the local clinics with the city. The most important thing that comes out of that is, disseminating the message. Because we're doing our work, the clinics are doing their work, but we also need people to know. And so if you look at, our Facebook page and United Medical Center's Facebook page, and I'm saying social media because that's, the era that we're in, they help you disseminate the message and what you're trying to get across. Okay. And so we could be doing all these kinds of things, but if people don't, hear it or see it, then you're obviously not going to target the whole population. And so by us being able to formulate that, and collaborate with the city of Eagle Pass, they're able to deliver the message, they do so, graciously. And that's how we're getting the message out there.
Great. That actually goes hand in hand with a question that Miss Katie had from the audience. She's asking about, you mentioned the community health clubs. So they actually tried to launch one at their organization, but their patient attendance is very low. Do you have people attend these community health clubs, and what is it that you do to attract people to the program? I know that you mentioned social media. Is there anything else that you might be able to share with the audience?
So we get a lot of referrals from our local clinics. And so it not just a referral from, their PA or their PCP. A lot of the times it's a lot of legwork. We go to the different neighborhoods. Oh, hey, we're going to be having this. Here we go. And you'd be surprised because, I'm not saying, like I said, they're well attended, but like anything else, you just wish you have more people getting that type of information. But we do have about 15 to 20 individuals at a time. A lot of the times, we've done this a couple of times where we go and set a table there at the local clinic, and our community health workers just invite anyone that comes in there, because remember that these are prevention services. So we're not just necessarily looking for someone that needs, the treatment or that's already, dealing with this condition. We're all about prevention too. So again, it's legwork. The community health workers know their neighborhoods, they know their neighbors know other people. And so just make sure that, whomever's doing this legwork, that they have those interpersonal skills. And a community health worker, a lot of the times has those types of skills.
Perfect. Thank you. Thank you both so much for sharing and for sharing your expertise and your experiences and everything with us today. I believe that was the only question we had, right, Maria? I don't see any others.
Yes, Megan, thank you.
Okay. So thank you all again so much for joining us. If you are joining us from the recording, then we will see you next time. And thank you so much for your time. But if you are joining us live, please stay on for just a couple of minutes to complete a brief evaluation. I see that Maria plugged it into the Q&A and the chat box. So if you can just fill out that brief evaluation, we'd really love to hear from you. We will also be going over some real quick upcoming events if you're interested. So thank you for your patience. I know that we went a few minutes over, and thank you so much to our speakers today.
Thank you.
Thank you, Megan.